you doing today?
I'm good.
My name is Brooke. I'm your student physical therapist assistant today. And before you get started in the gym with your exercises, I wanted to do some traction on your lumbar spine today because I know you've been having some increased pain due to that herniated disc you've been having in your low back region. Is that right?
Yeah.
Okay, so we're going to hopefully do some traction today to help reduce that pain. What was your pain rating coming into therapy today out of 10?
I would say like an 8, and then I have pain going down my leg too.
Okay, so it's radiating down
Yeah.
the leg a little bit? Okay. So we're gonna hopefully reduce that. I know you've had traction done before, but I just want to give you a little insight as to how it actually works. So when we put you on this traction table, when we strap you into the belt, we set certain parameters into the machine based on your body weight and the issue that we're targeting, which is obviously your herniated disc. And the traction is going to work to distract your body, kind of pulling it further apart, which is going to increase the space in the central spinal canal. So it's actually going to give that disc material that right now is being compressed, so it's protruding outwards. It's going to give that more space to kind of be sucked back in, so it's not pushing up against spinal nerves and causing you pain.
Okay.
So I just want to go over a couple things with you before we get started, just some cautions I want to take. You have no uncontrolled hypertension, correct?
No.
Perfect. And you never had any issues with hypermobility or instability in the trunk region?
No.
Okay. And no issues with claustrophobia, correct?
No.
Because these belts are going to be pretty tight just because we need them that tight to do the distraction that we need them to do, but it won't be uncomfortable by any means. And also, we want to look out for complete pain relief, because if you're having complete pain relief, that means that we're blocking a nerve, and if we're blocking nerves, that's ultimately going to cause increased complications down the road. So we definitely want to look out for that, okay?
Okay.
So do you have any questions before we begin?
No.
And is it okay, I'm going to be kind of touching your lumbar region, your lower back region to put those belts on, is that okay with you?
Yeah.
Awesome, okay. We'll get started, I'll help you up. We're going to lay you on your stomach because that extension position is going to help decrease that back pain as well, because I know you like to sleep like that because it feels okay. So we're going to do traction like that again for 20 minutes.
Okay.
And we'll get started, okay?
Okay.
So I'm going to help you up, lay you on the table.
Thanks.
You're welcome. So I kind of want you to just put your stomach down on these black pads.
Okay.
Okay. I'm going to go ahead and start applying the belts.
Okay.
Like I said, we need to get them a little tight in order for them to do their job, but I want you to be comfortable as well, okay?
Okay.
Sorry, putting these belts on is a little time consuming, but we'll get you going in just a minute.
Okay.
How's that feel, okay?
Feels good.
Good. Everybody. One last belt. Okay, how's that feel, Melissa?
It feels really good.
Awesome. Okay, we will go ahead and get started. I'm gonna go ahead and unlock the table. It's just gonna give the table room to move with the traction, okay?
Okay.
I'm also going to move this table up a little bit just to kind of line you up with the machine and its direction of pull. And Melissa, this right here is a kill switch. This is, if you push this red button, it will stop the machine immediately. If in the event you have any increasing pains, anything you can't tolerate, go ahead and push that button and it will stop, okay?
Okay.
I'm also going to go ahead and give you a call bell and a timer. Timer we're going to be setting for 20 minutes today. That's how long your treatment will be. So just so you know how much time is left. And this call bell is in the event I leave the room and you need me for any reason. Go ahead and give this a ding and I'll be back in.
Okay.
So I'll put that right there. So we have our parameters set in the machine. My max and min pulls are based on her total body weight, my max level being 25% of her total body weight, which is giving us 37 pounds, and my min is 12% of her total body weight, which is half of the max, so we get 18 pounds. I have this set at intermittent, which means we're gonna get an on and off time. On time 60 seconds, followed by a 20-second off period. This is just gonna help decrease the likelihood of any deformation of the tissues due to that constant pulling because of the increased weight. And we want an off time just to kind of give her increased comfort so she's not being pulled on for the entire 20 minutes. 3 steps up and 3 steps down is kind of just working our way up to those max weights. We have a 20-minute complete treatment time, 1 minute added to account for those steps going up and down at the end in the beginning. Okay. Okay, Melissa, we're gonna go ahead and get started. I'm gonna go ahead and start the machine. We're gonna do 20 minutes, okay?
Okay.
So treatment started. Okay, Melissa, you're all done. I'm gonna go ahead and stop the machine. We're gonna get you unhooked and we'll get you sitting back up and we'll head into the gym, okay?
Okay.
I'll go ahead and take those items in the kill switch from you.
Thank you.
You're welcome. Down a little bit, so it's easier for you to get off. I'm also gonna lock this table up, just so when you get off it doesn't move around, okay?
Okay.
How you feeling right now?
I feel good.
Feeling okay? Kind of feel the same way you did last time when you had traction done?
Yeah, it feels better.
Good. Exactly what we want. Melissa, I'm gonna go ahead and get on this side of you and I'll help you up. I want you to get up kind of slowly. Some patients, especially after treatment in a supine or prone position, like on your stomach or your back, they have some increased dizziness due to orthostatic hypotension, just from laying down for a long period of time. So I'm gonna help you up, nice and slowly. Very good, very good. Awesome. Okay, Melissa, I'm gonna go ahead and take a seat. If you wanna just go ahead and sit in this chair for me.
Okay.
How are you feeling? You feeling okay?
Yeah, I feel good.
Great. What would you say the pain is right now?
It feels like a 6 and I don't feel it as much in my leg.
Perfect. That's exactly what we want. We were trying to centralize that pain back into your trunk area. So I'm glad that that pain is kind of going away. And I know you've had this before and you liked it this time, so I think we're going to continue this when you're in treatment. I think it really benefits you for pain relief so you can do your exercises better afterwards, okay?
Okay.
Do you have any more questions for me?
No.
Okay, let's go into the gym. We'll start some exercises.
Okay.